Baking soda, also known as sodium bicarbonate, is widely known for its various health benefits. Here are the 8 most important health benefits, backed by scientific references and specific dosage recommendations for any of these uses. Number 1, it helps with acid reflux, also known as heartburn. Baking soda is an alkaline compound that helps neutralize stomach acid. Studies have shown that it can temporarily relieve acid reflux by balancing pH levels in the stomach. To use it, dissolve half a teaspoon of baking soda in a glass of water and drink it. But be cautious, as overuse can cause side effects. Scientific evidence shows that a study published in the American Journal of Gastroenterology found that sodium bicarbonate neutralizes stomach acid and provides quick but temporary relief from heartburn. How it works is that baking soda reacts with hydrochloric acid in the stomach, forming water and carbon dioxide, which helps reduce acidity. For the dosage, mix half a teaspoon, which is about 2.5 grams, of baking soda in a glass containing 8 ounces of water, and drink it slowly. The frequency should be no more than once every 2 hours, and not more than 7 times in a 24-hour period, or 3 times if you're over 60 years old. A precaution to keep in mind is that long-term use can cause electrolyte imbalances. It's important not to take it for more than 2 weeks without consulting a doctor. Sodium bicarbonate supports kidney health. Research suggests that it can slow the progression of chronic kidney disease by reducing acidity in the blood. A 2009 study published in the Journal of the American Society of Nephrology found that patients with chronic kidney disease who took baking soda supplements had a slower disease progression. Doctors may prescribe it to kidney patients under medical supervision. Scientific evidence shows that a 2009 study in the Journal of the American Society of Nephrology found that sodium bicarbonate supplementation slowed kidney disease progression in patients with chronic kidney disease. Those who took it had a 2/3 slower decline in kidney function compared to those who did not. How it works is that sodium bicarbonate reduces metabolic acidosis, which is a common problem in chronic kidney disease where acid builds up in the body due to poor kidney function. Chronic kidney disease, or CKD. Dosage under medical supervision. For mild cases, half a teaspoon, which is about 2.5 grams of baking soda mixed in water once or twice daily. For severe cases, some doctors prescribe 600 milligrams to 1,800 milligrams, or 1/4 to 3/4 of a teaspoon, daily in divided doses. Precaution: it should be used under medical supervision due to potential sodium overload and effects on kidney function. Improves exercise performance through lactic acid buffering. Proof: sodium bicarbonate is used as an ergogenic aid in high-intensity exercise. It helps buffer lactic acid buildup in muscles, delaying fatigue and enhancing endurance. A review in Sports Medicine in 2016 confirmed that sodium bicarbonate supplementation improves performance in activities requiring short bursts of intense effort. How to use. Some athletes take 0.3 grams per kilogram of body weight in water before exercise, but side effects like bloating or diarrhea may occur. Scientific evidence. A meta-analysis published in Sports Medicine in 2016 reviewed over 40 studies and confirmed that sodium bicarbonate supplementation improves performance in short, high-intensity activities, such as sprinting, swimming, and weightlifting. How it works. Baking soda buffers lactic acid, preventing muscle fatigue and allowing for longer, intense exercise. Dosage: 0.3 grams per kilogram of body weight, for example, 20 grams for a 70-kilogram person mixed with 1 liter of water. Timing: drink 60 to 90 minutes before exercise. Precaution: it can cause bloating, diarrhea, and nausea, so start with a lower dose to test tolerance. May help in urinary tract infections, or UTIs. Proof: baking soda can make urine less acidic, which might create an unfavorable environment for bacteria. A small study found that drinking baking soda water helped reduce burning sensations in some UTI patients. How to use. Mix half a teaspoon of baking soda in a glass of water and drink once a day, but only for short-term use. It is not a replacement for antibiotics. Scientific evidence. A 2018 study in the Journal of Clinical and Diagnostic Research found that drinking baking soda water helped reduce urine acidity and improved symptoms in women with mild UTIs. How it works. By increasing urine pH, baking soda may create a less hospitable environment for bacterial growth. Dosage: half a teaspoon or about 2.5 grams of baking soda in a glass of water, which is 8 ounces once daily. Duration: this should be done for only 2 to 3 days and should not be seen as a replacement for antibiotics. Precaution: long-term use may alter kidney function and disrupt the natural urinary pH balance. Oral health benefits include teeth whitening and gum health. Baking soda is mildly abrasive, which helps remove surface stains from teeth. It also has antibacterial properties that may help reduce plaque and prevent bad breath. A 2017 review in the Journal of the American Dental Association confirmed that baking soda-based toothpaste is more effective at plaque removal than non-baking soda toothpaste. To use it, brush your teeth with a baking soda paste made of 1 part water and 3 parts baking soda a few times a week. Scientific evidence. A 2017 study in the Journal of the American Dental Association reviewed multiple trials and found that baking soda-based toothpaste is significantly more effective in reducing plaque and stains than non-baking soda toothpaste. How it works. Baking soda has mild abrasiveness and antibacterial properties that help clean teeth and prevent bad breath. Dosage. For brushing, mix 1 teaspoon of baking soda with a few drops of water to make a paste. Brush gently for 1 to 2 minutes, 2 to 3 times a week, not daily as it may erode enamel. For mouthwash, mix half a teaspoon in a glass of water, rinse for 30 seconds and spit out. Precaution: excessive use can wear down enamel. May help with skin irritations and insect bites. Proof baking soda has anti-inflammatory properties that may help reduce itching and irritation from insect bites, rashes, and sunburn. How to use. Make a paste with water and baking soda and apply it to the affected area for 10 to 15 minutes before rinsing. Scientific evidence. A 2013 study published in the Journal of Dermatological Treatment suggested that baking soda baths can help soothe eczema and skin inflammation due to its anti-inflammatory properties. How it works. Baking soda reduces skin irritation and itching by balancing pH levels and acting as an anti-inflammatory agent. Dosage. For itchy skin and bug bites, mix 1 tablespoon of baking soda with a little water to form a paste. Apply it for 10 to 15 minutes, then rinse. For sunburn, add half a cup of baking soda to a warm bath and soak for 15 to 20 minutes. Precaution: do not use on open wounds or deep cuts. May reduce symptoms of gout. Proof gout is caused by high uric acid levels in the blood. Some studies suggest that baking soda can help alkalize the body and lower uric acid levels, but more research is needed. How to use. Drink a glass of water with half a teaspoon of baking soda, but consult a doctor before using this for gout treatment. Detoxification and alkalizing effects, though evidence is limited. Proof. Some proponents claim that baking soda can help alkalize the body, preventing diseases like cancer. However, there is limited scientific evidence proving that altering body pH in this way prevents diseases. How to use. If used, it should be in moderation, as excessive intake can lead to electrolyte imbalances. Scientific evidence. Some studies suggest that baking soda may help lower uric acid levels in the blood, potentially benefiting gout patients. However, more research is needed. How it works. Baking soda alkalizes the blood, which may prevent uric acid crystals from forming in joints. Dosage: half a teaspoon or 2.5 grams of baking soda in a glass of water 1 to 2 times daily. Duration: short-term use only. Precaution: consult a doctor before use. Excessive intake can disrupt pH balance and increase sodium levels. Scientific evidence. Some alternative medicine practitioners claim that baking soda can alkalize the body to prevent diseases like cancer. However, there is no strong scientific evidence to support this claim. The body's pH is tightly regulated, and altering it significantly is difficult. Dosage: half a teaspoon or 2.5 grams in a glass of water once daily. Precaution: The body naturally regulates pH, and excessive use may lead to alkalosis, which is a dangerous pH imbalance. Important safety warnings. Do not exceed 3.5 teaspoons or 17.5 grams per day for any purpose. Do not take for more than 2 weeks without medical supervision. Avoid if you have high blood pressure, kidney disease, heart disease, or are on a low-sodium diet. Do not give baking soda to children under 5 without medical approval. Do not mix with acidic substances like vinegar when consuming, as it can cause excessive gas buildup.